Yeah.
Okay. One of the worst fears for parents is for their innocent little baby to have something wrong. How would you feel if your child was born with a fluid-filled sac on their back that contained their spinal cord and many of their spinal nerves? That is the parent's worst fear. I would like to inform you about the main types, effects, causes, and treatments of spina bifida. I will begin with describing what spina bifida is. Spina bifida is a neural tube defect, and it normally, after the 28th day of conception, the neural tube forms and closes. But with spina bifida, the neural tube fails to develop and does not close properly. And in this, you can see how after 21 days after conception, it starts to form and it starts to close. But with spina bifida babies, it has a little hole in it. It's not formed. And this is just a ultrasound, and you can see where the hole is for the spina bifida. And patients with spina bifida usually have a lesion anywhere from the midline of their body between the neck and buttocks. And this is just a picture of an x-ray, and you can kind of see where it's the little defect is right there. They also have a large filled sac filled with the meninges and possibly part of the spinal cord. And with the nerves and tissues exposed, spina bifida babies are really susceptible to life-threatening infections. And spina bifida usually occurs in 7 out of every 10,000 births in the U.S. according to the Spina Bifida Association. Now that you know a little bit about spina bifida, we can talk about the main forms. There are 2 main types, and the first one is spina bifida cauda, and this is usually the most mildest form. It's a single deformation in the single vertebrae in the cervical, lumbar, or sacral regions. And these are just some more pictures. But in this one, you can see where this is the cervical region, the lumbar region, the sacral region. That's usually where they occur. And with the cauda, they usually don't have any neurological symptoms. The second type is meningocele, and this is the rarest form of spina bifida, and it's where the spinal cord can remain open and it can be along several different vertebrae. And in this type, the spinal cord normally pushes out through the vertebrae. Now that we know the main forms, we can discuss the effects of spina bifida. There are many side effects from spina bifida. Malformations are very obvious at birth, like we saw in that picture. You can kind of see it on their back. It's usually a sac filled. But they can have from anything from just a little dimple to a port wine colored stain or a patch of hair. And that's kind of like what it would look like if they had a little hairy patch. And then that's a port wine stain. And usually 75% of cases occur in the lumbar region, which was that region right there in pink. They also deal with many physical effects. The higher the lesion on the vertebrae columns, the higher up it is, the more spinal nerves are affected. And they usually have to deal with saddle loss of sensation, which is basically like when you ride a horse, all the area that touches the horse's saddle is usually where they have a lack of sensation. And they can also have lack of leg movement, lack of anal reflex, and some infants can develop what is called hydrophilia, and that's when there's excess fluid in the 4 cavities of the brain. So now that we know the effects, we can talk a little more about what causes spina bifida. And no doctor is really sure what causes spina bifida, but it can be a result of genetic and environmental risk factors, which include the folic acid deficiency, which normally early in pregnancy, if they have low folic acid, that increases chances of spina bifida. They aren't really sure what relates it, but it's been proven. And there's also a higher risk with family history, if they have family history of spina bifida or neural tube defects, and it's also more common among whites and Hispanics. Now we can cover the treatments for spina bifida. The main treatment for spina bifida is surgery. And there are basically two different kinds of surgery. And there's open fetal surgery. The Gale Encyclopedia of Genetic Disorders talks about this. It's kind of still in its experimental stages, but they produce direct closure of the malformation of the spine and fetus and return it back to the womb. This also kind of creates a higher risk for early pregnancy or early delivery, but it usually takes place between the 19th and 25th week of pregnancy. And there's also the afterbirth surgery, where they can try and put the meninges back into place and close the opening. And it's usually done within hours or days after the baby is born. And the earlier the surgery, it helps to minimize the risk of infection because they are so susceptible to infection. And the first surgery is usually followed by many, many more. The third kind of option they have is for therapy, which is usually after the surgery. They have multiple different types of therapy. They have physical therapy. You can also get bracing, orthopedic assistance, and early education intervention is also helpful to help them to improve self-image because they usually have a problem with that. So tonight I have informed you on the main types, the effects, the causes, and treatments of spina bifida. I hope you have more knowledge about what spina bifida is, how it affects young children, and its causes and treatment options. For many new mothers, this can be very scary and devastating news, but families can look forward to knowing that most spina bifida patients live on to live very productive lives. And they should know there are many support groups. The Spina Bifida Association has many, many support groups. I personally know someone who has spina bifida. A friend of mine, her little brother has spina bifida, and he's leading a very productive life. He has a few challenges here and there, but he's leading a pretty productive life.